with that person. Then we have the common cause. When we talk about common cause, the cause that are applying to both partners. We have age. It is believed that any couple above 35, 40 years and above, they experience delay. So age can contribute to it. We have obesity. It is also believed scientifically that too much weight or uncontrolled fat and weight of the body can contribute to infertility. We have the mental health also, which Mrs. Losumo will talk. If you are not mentally stable, there's possibility that you can get pregnant. Even if the husband is trying or his best, trying to make you pregnant, if you are the lady, you are not psychologically okay, you are stressing yourself, it is scientifically proved that you may not conceive. And when we talk about all this, we can also talk about diet. Diet is an important aspect in the life of any growing up child. So once we notice that our children are growing to a certain age, we should endeavor to give them a nourishing, balanced diet. It's not until when you are rich, like Abiola or like Dangote, can just give them something nourishing, something good. And it is also advisable for you to get multivitamin for them. When you get to this pharmaceutical shop, you will see them selling multivitamin. Just tell them the age of your children. They give you. You can get them. Even as simple as Bico and Motivite folic acid. But if you want to give anybody folic acid, make sure you rule out everything like cancer cell. Because it's not advisable for the person with cancerous cells to take folic acid. But if the person has ruled out all that, you can as well give them to folic acid supplements. So when we talk about the treatment is what the causes are. And when we are talking about the treatment, we can categorize the treatment into three parts. We have the medication aspect. The medication aspect, once an individual, especially when it comes to infertility, is the lady that carries the burdens most. Let's say 85% of it is on the woman. The man will say, "Ma kanju, Ọlọ́run wà lórí ìtẹ́," you know, such a thing. So, women of that aspect, they'll go see medical attention. By seeing a gynecology, they can place them on Clomid tablets. And that Clomid tablet is just for them to regulate their ovulation or to make them ovulate. I'm sorry to say, I could have tell you, out of the woman causes, some women don't ovulate, although they menstruate, but they don't ovulate. So after seeing medical attention, the gynecologist will examine you and monitor you through the use of ultrasound and some other machine. If they notice they are the type that menstruate without ovulating, they can place you on that tablet, Clomid. They'll place you, that one help you to ovulate. And they also give some people metformin. That won't help in cysts, ascites, fibroid. That won't help in that aspect. And you will notice that some women, they are not breastfeeding, but they do, when you press their breast, they lactate. So they give them metformin to regulate all the hormone system in the body. Then secondly, we talk about the surgical procedure. This surgical procedure is when an operation is being performed. And the operation can be performed either on the male partner or on the female partner. When you talk about the female partner, I talk about infection. If it's not well treated, it blocks the fallopian tube. So after a series of investigation, they see that the fallopian tube is being blocked. There is a way they introduce some substance into the tube to make it potent. And if they notice that it is a fibroid that is growing, they will advise you to have myomectomy done. They bring out the fibroid. I can say most of the causes of infertility, about 30% is fibroid. That they will just say, I'm not getting pregnant, I'm not getting pregnant, I'm not getting pregnant. By the time you get to the gynecology, they will find out that maybe that fibroid is located in a particular place that is obstructing the implementation of the zygote. So they will just operate the fibroid away. And we also have for the male, there is something we call epididymis. It is a coil-like structure in the male organ. This organ helps to transport the the sperm during sexual intercourse to the woman, and it also stores the sperm. But sometimes there is a blockage to that coil-like structure. So they also do surgery for the man, and they do the surgery to correct the epididymis, that is the blockage of the epidermis, which helps to store the sperm and transport the sperm. Then the last one that I will talk about is, there is something that we call assisted hello? There is something that we call assisted conception. Why did they, yes. Why did they call them assisted? Why they find out that the woman, after being on drug, after making the tube potent, there is nothing happening. They will introduce some method to them. In this assisted one, we have various methods, but I will only talk about two. We have the surrogate mother, we have the IVF, we have the intrauterine insemination, which is also known as the artificial insemination. This involves inserting a sperm into the woman's ovum. For this artificial insemination is when they find out that the man, after placing them on drug, there is some things that you can't explain the cause. The cause is idiopathic. The cause is unknown. After that, they will introduce to the partner that, well, your husband has been on some drug. They will introduce it when that woman is ovulating and start monitoring. Luckily, the person can, from that aspect, get pregnant. Then we have the in vitro fertilization, which is known as the IVF. Here, the egg are being vitalized outside the body. There is a way they do it. You know, after waiting, some people have waited. Some of us are lucky. Immediately you get married, the following month, 6 months, a year. But some people, I've known of some people that have waited 5, 6, 8, 10, 12 years. I've known of a patient that has waited for 15 years. So after waiting, there's nothing impossible for God. They introduce this IVF to them. Once you have the money to do it, they fertilize the ovum outside the body. After the fertilization, they will now introduce that fertilized zygote into the woman. You won't know about the donor. They've made it that you won't even know about the donor also. So after they fertilize, there is a way they do it in the lab. They do it in the lab. You won't know. So they can introduce like 4 or 5 different into you. So at the end of the day, some people, at the end of the day, 3 might survive. Some people, 2 might survive. Some people, out of the 4, it might be 1 that survived. And when you talk about the surrogate mother too, in that aspect, it's possible you have incompetent cervix of uterus that cannot carry baby. The husband's sperm is okay. There is a way they will introduce your husband's sperm into a mother, into another woman. Even there is a way they do it that you and that woman will not see yourself. You won't talk to each other. And that one has a legal backup. There is a way they do it. There is a legal backup. Then you pay the person up. So that in the future, the woman will not come to you. Even when she's delivering, you will be in the hospital bed also. You will be taking injection. You'll be taking fluid. You'll be taking everything. The woman will be in the room A. You'll be in room B. So immediately the woman delivers, they transport her to another health facility. So the baby will be given to you. Knowingly that is your husband's child, but you are not the one that carry. But at the end of the day, you are a mother, and nobody will know. Once you don't tell anybody, nobody will know except the health worker. But there is a legal backup that even those health workers too will sip her mouth. So those are what can cause infertility and the treatment of infertility. And we also, I will just talk lastly on ovulation monitoring. Most people, they don't know when they are actually fertile. Although some people may not ovulate, but it is believed that every woman has a cycle of 28 to 35 days. So you have to monitor yourself for the first 3 months to know. Assuming you are of 28 days, let's say you start your menstrual period on the 1st of May. You count Some people will breathe, they share blood for 3 days. You can't first, second, third. You know you have shared your blood. Then you carry the proliferative phase. In this proliferative phase, ovulation also occurred in that phase. So you will count. It is believed that once you have a 28 cycle, your ovulation will come in the middle, which is 14. So you can start from the 13, 14, 15. So within that 3 days, which is 72 hours, there is a possibility of you ovulating. So in that aspect, they will encourage the couple to meet during that time. So there is possibility of them to conceive. So I don't know if you have any other question to ask. That's what I could talk about.
Praise the Lord. Okay.
Hallelujah.
My first question is the issue with the sluggish sperm. The baby that comes out from that, is that the result of some children being not smart? And that's my first question.
The second one, too.
And the first one I'm trying to find out, when I talk about the support assisted contribution, is it through operation they need to implant the sperm, or the process that makes the baby to fertilize?
Okay. The first one, I talk about low mobility of the sperm. That is inability of the sperm to move fast. So, that is inability of the sperm to move fast. I can't say that actually will lead to the child being sluggish, because for every individual there is a gene, there is a genetic makeup, but I can't say that causes it. I don't have a proof to that. But what we mean by low mobility is that the man's sperm are okay, there is a good sperm count, but the ability for them to swim fast, it's just like I'm standing here now. I have just an egg with me. And we have like 300 children in the class. And I will tell them the first person to touch me, I will hand over this leg to me, to hit the person. Now imagine those children. God will not allow us to have imbecile children. They are doing slowly, slowly. And I have a limited time that I'll wait here 5 minutes. After 5 minutes, nobody gets here. I'll throw the egg away. Remember that the ovum that is being released to, if there is no fertilization that occur, the ovum will break. It will shed. If there is no fertilization, have menstruation. But have it at the back of your mind also that some women don't ovulate. They call it aovular menstruation. They don't ovulate at all, but they see menses. So imagine that person believing that I'm seeing my menstruation. Once my husband meets with me, they've taught me the ovulation period. The person will keep having sex to 10 years' time, and the person will not have anything. If the person does not see medical attention, it's when they carry out some tests, series of tests, hormonal tests, there is a way they do it. You know, when we're talking about menstruation, there is follicle stimulating hormone, there is estrogen, there is progesterone. Those are the factors that are responsible for the release of the ovum. So if the sperm didn't get to the ovum on time, the egg also will break and come out as a messes. So relating it to a child that is being sluggish, I'll say it is based on the genetic makeup of that individual. And secondly, this method there is some people that are specialized in it. There is no, it's a surgical procedure, but they use some fine instrument. When we talk about a fine instrument, tiny, fine instrument, that after introducing it to the uterus, there's a way they close it. They can go through the vagina, through the cervix, to the uterus. So it depends on the condition of that individual. So there's no, you won't see the scar on them, but there's a way they use fine instrument to introduce those zygotes into them. Ma.
Thank you, Ma. I have two questions. One, what causes stillbirth?
Triplets.
Yes. And is it
Stillbirth.
stillbirth? And is it normal for a woman to menstruate for 2 days?
Yes. Yes. I'll talk about the stillbirth. So many things can contribute to the stillbirth. Firstly, there is this incompatibility. I can't really remember the name now. That, yes, incompatibility. Assuming I'm married to a husband, I am group AA, and my husband is O positive. I am, okay, or my husband is O negative, I am O positive. And peradventure, we got pregnant. Before 3 months, I loses the pregnancies. You know, there is a way I will know the blood group that child is carrying. I will know maybe it's positive or negative. And most people, if you don't go to a well-specialized hospital, they will just treat you on a normal ground. They won't go into deep history to ask you, what is your group, what is your genotype, what is your blood group. But if you go to a specialized hospital, you tell them my blood group is B positive, my genotype is AA, my husband's genotype is AA, his blood group is O negative. The person being specialized, we know that there is a possibility of the conception you have that you miss, that baby, carrying the FIDA O negative. So they will give you antirogan within 72 hours so that the antibody of that of that positive, you know you're a positive mother, you are carrying a negative mother. If that injection is not given on time, your body will form an antibody. That is, you're having you're having positive, negative, positive, negative. So by the time you now conceive another child, and you don't know, towards the time of delivery, there is possibility there is an in utero death. That some people want to go more here like 38, 37 weeks. They will just find that there is no longer fetal movement. By the time the person will deliver, stillbirth. So they will now start monitoring. I've seen a woman that lost 6 children unknowingly, until when they were not asking, taking history. When she came to UC, they were not taking history. What happened? They now did the husband blood group. They found out the husband was O negative, she was O positive. That can cause it. Other causes is, you know, you are supposed to carry pregnancy. The term of pregnancy is between 37 weeks to 40 weeks. So if you don't give birth within 37 weeks to 40 weeks, anything above 40 weeks, the doctor will offer you cesarean section. That cesarean section is basically for your good and for the good of your baby. But some people, they will tell you, you know, the hormone at 37 to 40 weeks, everything starts decreasing. The placenta starts degenerating, the liquor, everything starts degenerating. So if the child is not getting enough, there's possibility intrauterine death, which can lead to stillbirth. But peradventure, you are lucky that immediately you get pregnant, you deliver, and they've done your blood group, you are O positive, your husband is O negative. Immediately, even they give, I think is it Mrs. Sudosume? I'm not really sure. In pregnancy, they give antirogan too, but I'm not sure of the weeks. They give, I think maybe from 24 weeks and above. Then after delivery, within 72 hours, they will also give you They are giving you to prevent subsequent baby. Some people, they don't know. After giving birth to that one child, that will be the only child they will ever have, because the body has already formed an antibody against the husband blood group. That's why once you are experiencing infertility, it is always good to speak out and to see a gynecologist or any specialist in that field, ma. Any other question, ma?
Thank you very much. My question is, you made mention of giving children multivitamins. For me, I thought maybe it's when the child is ill and is not eating, that's where you can give multivitamin. When they are okay normally, can we still give them multivitamin?
Yes.
Okay.
It is advisable. And it is advisable nowadays. This our Nigeria, most of our food has been exposed to sun. And sun destroys most of our vegetables, oranges, fruit. So it is always advisable. The only thing it's not advisable to give that I said is the folic acid. But when you go to any pharmaceutical church, just mention the age of your children. Vitamin A, vitamin D, vitamin C,